Hey everybody, this is John Marshall, and I'm with one of the amazing leaders of the Colorectal Cancer Alliance, Kim Newcomer, and the two of us are here to talk about what's going on. We are on the floor, ASCO 2022. It's Monday. It's a little rainy.
A little bit rainy.
But that means people are here.
They're here.
They're not going anywhere else. And so, have you been having fun?
I've been having a great time. It's been great to be back in person again, and it's great to see all the patient advocates here.
Yeah.
And it's been great to look at some of the science and some of the new things coming out. So I was really enjoying the abstracts this morning. What do you think, with the late-breaking abstracts, what do you think has been the most important of them?
Well, I think one of the most important theme across all these abstracts is that we now have to clearly recognize that left-sided cancers are different than right in terms of how they behave. They're different in I think we were one of the first to publish that, in fact, that they're different in what percentage they express different things. And when you pull out that all wild type, RAS wild type, BRAF wild type, and left-sided, you have a group that is by far the best behaving group of all of colon cancer. Instead of a couple of years of survival, you're looking at 3+ years of survival. You're looking at initial control of disease in the 1 to 2 years, not in the 9 to 12 months.
So
it's clearly behaving differently. And going forward, I think all clinical trials are going to have to pull those patients out. I mean, I think like triple negative breast cancer, you have different rooms for ER, PR, and HER2 and all of that. We need that now in colorectal cancer.
Right. And so what do you think of the is it the Star Trek? Is that something that phase 3 is going to look something totally different than what phase 2?
I hope so. We always want it to look totally different. Yeah, I mean, the principle there is sort of organ preservation. And I guess Star Trek too boldly go where no rectal tumor has gone before. And the idea is to try to avoid having to have a permanent ostomy, having major surgery. We saw in the New York Times yesterday an article that said if you're MSI high, maybe you can just use immunotherapy, and that's very provocative. This is for everybody else. Can you do a less invasive, less aggressive kind of approach that doesn't involve surgery and not get into too much trouble? And I think the theme of this was in the right patient with good imaging. The answer is yeah.
And so do you think we'll be having more treatments coming down the line for microsatellite stable patients? I know we've been using the same drugs for years. What is the answer? Is it using the same drugs in different combinations, or is there anything coming down the line that we can?
The answer is no. We're still stuck with the same drugs, but we are getting smarter about how to use them and how many combinations, how many do you need at once. But I also think one of the other themes of all of this is the acceptance and recognition of metastatectomy, removing metastatic disease in stage 4 cancers, and some debate about removing primaries and the role of surgery, et cetera. So that's here to stay. We're getting better at it, and we're both generating progression-free survival as well as improvement in some cures in patients.
All right. Well, that's fabulous. I don't know if you have anything to add about
the
abstracts, but
what's been like a great advocacy moment for you, like why you came and why it's better than doing it online, for example.
Oh my goodness, I got to meet with the FDA yesterday.
Oh, you did?
Yeah.
I would rather meet with them online myself. I mean,
that was exciting. No, it's really fun, and I've liked going to some of the sessions on clinical trials and how COVID-19 and telehealth is hopefully going to help people do clinical trials where they're at, being able to work with their own provider, and maybe bring more trust to other communities. So that's been fun doing that, and just seeing everyone again, talking to the researchers, talking to the doctors, and talking to people who don't know anything about colorectal cancer. It's still like what drives me. And one of my highlights was seeing you and your wife speak at the breakfast and your book.
Great segue on that one. Yeah. Bonus points. All right.
No, it was great though.
The Colorectal Cancer Alliance and the Ruesch Center, we are great friends tied at the hip. We're happy to come to you live from ASCO 2022. Have a good week.
See you next year.